Emergency Council of Norristown, ICN, is a consortium of organizations and individuals concerned with improving the quality of life and the delivery of human services within the greater central Montgomery County area. We bring people together in the region to promote collaboration and cooperation among social service organizations, community groups, local government, and residents. Through this show, ICN presents Making Connections. We will consider a variety of topics that will identify community resources and needs, and we'll discuss quality of life issues. We'll talk about strategies for strengthening our families, healthy lifestyle choices, and volunteer options. We hope you'll find our show informative and helpful. Today we're going to discuss health and safety issues. In our first segment, we'll talk about immunizations, and in the second portion, safe use of car seats and some other safety tips. For our first segment, I'm joined by Carolyn Zimmerman. You're an immunization nurse with the Montgomery County Health Department. Welcome.
Thank you.
And by Giselle Knobloch, who's a nurse at the Norristown Area High School with the Norristown Area School District. And we're glad that both of you are with us today to talk about immunizations and how the immunizations are important for individuals' health as well as for our community health. Maybe you could get started telling me a little bit about that. Why does that make sense?
By everybody being immunized, it protects the community. There are people within the community who cannot get immunizations.
Okay.
And we kind of build a cocoon around them by everybody being immunized.
By the rest of us being immunized. Mm-hmm. Maybe I should step back and say, what is immunization? Why are we talking about this? I don't know which one of you would like to talk about that.
Well, immunization is a way to protect the health of individuals against diseases that ran amok for years and centuries, and people died from. And through science, scientists discovered ways to protect people against these diseases and to lengthen their lives because of it. And that's one of the reasons that we immunize.
Right. So what are the kinds of diseases that we're talking about here?
Well, there's 14 different vaccines that protect you against different diseases. It's like tetanus, diphtheria, pertussis, measles, mumps, rubella, chickenpox, polio.
Okay.
Some of these diseases people haven't seen in years.
Because we've been able to immunize. I do, my mother's in her 70s, and she and her brothers and sisters, they were, the story about being quarantined because they had measles. And then as I was a child, there was some immunization, and now there are even more.
Yes.
So it's that kind of thing that we're able to prevent people from having a disease, so it makes sense then to take advantage of that. Now, one of the things we were chatting about before the show is that, I think we're all familiar with the idea of babies getting immunizations because they have certain protection from their mom for a short time, and then we want to make sure they're part of that pool, protecting themselves as well as the community. And yet, in recent years, we've been hearing more about older children needing either second doses or new immunizations. Can you tell me a little bit about that?
Well, what happens is, after a point of time, through research they've discovered, your immunity wanes.
Okay.
So that's why they need the second, or a booster, another shot. And so right now we're adding the TDAP with the pertussis.
TDAP.
Yeah. Tetanus, diphtheria, and pertussis.
Okay.
For the 11 and 12-year-olds. And we're also adding a second dose of varicella, which is chickenpox, and also the meningitis shot.
Oh, wow. The meningitis is a very serious fever. It's caused by an infection, I guess, but that can kill you.
Yeah, it moves quickly.
Really? Okay. Okay. So we have some new regulations then too. Immunizations, are in part governed by the healthcare community, suggest these things, but then there are requirements. Certain immunizations become, you must do this, for the law, in order, I guess, to protect ourselves and the community. So tell me about what's happened recently.
Pennsylvania has school immunization requirements by law that children have to have certain immunizations. And what's happening this year is that for 7th grade students, there's the addition of the TDAP, which Carolyn spoke about, and the meningitis vaccine. And additionally, all students need 2 doses of the chickenpox or varicella vaccine. And that will become effective August 1st. The district, Norristown District, is sending out information to parents now, and have been sending it out, that notifies them that this requirement is coming. And we've asked parents to send in the information by June, so that all the records can be updated and no one has to be kept back from school because they don't have the correct immunizations.
So an immunization, let's just go back even further, is typically administered through an injection. How are these administered? You're an immunization nurse. Tell us.
All of them except the one that a baby gets right now is all injection.
And when you're talking about kind of a booster for this diphtheria and pertussis and tetanus, and then the meningitis, and then the 2 chickenpox, I can say that better, than varicella. Okay. Is that 4 separate injections that need to take place over time?
3, and they can get them all at one time.
Wow, great. That makes it easier. Parents can take their children to their family doctor,
Right.
to a local health clinic,
Right.
and to the health department?
Yes.
Okay, in order to obtain these immunizations.
We do ours by appointment, the same as most doctors do.
Okay.
They can call the health department.
And are there fees?
No fees at the health department.
At the health department. And, okay. Is it an income base, though?
No,
Okay.
it's all free. It's really, it's a Pennsylvania vaccine for children
Right.
that we use, so that vaccine is all free.
Okay, great. That's wonderful to know. Now, I've heard some people say, immunizations, that's not for me or my family. I'm concerned that my child's going to get sick if they get immunized. What can you tell me about that?
Well, basically the vaccines don't make anybody sick. Anybody can have a reaction to the vaccine with a temperature or a sore arm, something like that.
Sure.
However, the disease is so much worse.
Right.
And if you don't, the death or complications can come from the disease. You know, you have to kind of think of that.
So it's much better to be